I'm Dr. Alan Schwartz, and we're interviewing one of our patients who has started the Kachatrian protocol. What is your name, please?
Monina.
Monina. How old are you, Monina? If you wish to answer that, you may. If you don't, you may not have to.
I'm 68 years
68 years old. And what is the nature of your medical problem, if you have any?
My medical problem. I have high blood pressure
Okay.
and high blood sugar.
High blood sugar. How high has your blood sugar been at the highest? Do you know the highest it's ever been?
It was 127.
That's not terribly high. That's a fasting specimen before breakfast?
I had to request it from my doctor, the latest one. I was again given taken the blood, and I don't know the result yet because
Yeah, we don't care about that. That's okay. You have a recent test that you don't have the results back on, but before it was 127.
127.
My question to you, was that taken in the morning before breakfast? What time did they draw the blood when they had the blood glucose taken? What time of day was that?
They draw the blood at the Quest Laboratory.
I didn't say where, I said when. What time of the day did you have the blood drawn?
Morning. First thing in the morning without any breakfast.
That's what I was asking. Okay. And when did you notice the blood sugar being high for the first time? How long ago was that?
Oh boy, that was several years ago, more than.
And what did the doctor tell you to do for that?
I was given a prescription drug.
And what was the name of the prescription drug?
For my blood sugar, it's glucopad.
Glucophage. Did the doctor think that you had diabetes?
Yeah, they said I have high blood sugar, and then so I was given that medicine.
Did they say it was diabetes? Did they use that word or not?
Yeah, I think they did.
They did. Type 2 diabetes. So you have high blood pressure as well, you say? And how high was your blood pressure?
It was the last time was the first time I went to the doctors 2 months ago. It was 162 over 100, and then after 6 weeks, it was 134 over 90.
And were you taking some medicine to help lower the blood pressure?
Because I have, before my blood pressure, because before on the prescription drug, I read about the side effects, so I discontinued for my high blood pressure, and then I resorted to natural medicine.
So your blood pressure was coming down without the help of any prescription drugs?
No, yes, not the prescription drug, but I'm taking by Dr. Sinatra, who writes.
Yes, I'm familiar with Dr. Sinatra. He is a cardiologist who uses natural remedies like CoQ10, ribose, and carnitine to help people. Are you taking any of those supplements?
Yes, also by Dr. Sinatra, the omega.
The omega 3s.
And then vitamin C and vision.
Something to help you with your vision. Are you having problems with vision or hearing?
Oh, it's only when at a distance. In reading.
In reading, you have trouble with reading.
Yeah, I don't have any problem with right now, but when I read, especially the small prints.
That can be a problem, reading small print.
Mm-hmm.
Do you have cataracts or glaucoma?
Well, the optometrist about a year ago when she examined my eyes, she said I am starting to develop a cataract.
Uh-huh.
And I said, what should be done about it? And he said, none. No,
Nothing
because-
unless it gets worse.
Yes.
And at the start of the therapy here at this clinic, was your blood pressure still slightly high, 130 over 90? Or had it gone down beyond that?
Oh, I haven't checked.
You haven't checked it recently? Okay. How was your energy level before starting the therapy here at the clinic?
When I started,
Before you started, how were you feeling? Did you have lots of energy, an average amount, or low energy?
oh, well, I was feeling good. I didn't really have any terrible problem.
That's good.
Mhm.
How was your appetite?
Oh, very good. I don't have any problem about eating, and I restricted my eating to vegetables. And,
When did you do that?
Because I have been a vegetarian for a long time for health reason, and because they said meat is well. There are some implications. Not that if you eat a lot of bread, especially red meat, you'll develop a heart problem.
And do you take an animal protein like egg or dairy protein in your diet in addition to vegetables, or is it just vegetables? Do you eat fish? Do you take?
Yes, I eat fish once in a while, but mostly fruits and vegetables,
Mostly
and rice, brown rice,
Brown rice.
every lunch and dinner.
Do you eat yogurt or any milk products like cheese?
Oh, no cheese.
Do you eat eggs at all?
Yes.
Eggs.
Eggs. Yes.
Eggs, yes, once in a while, but
Not
we
commonly.
should usually when we eat eggs. When I eat egg, I usually only want to eat the white
Okay.
because they said the yolk contributes to your cholesterol.
It doesn't significantly in most people, as it turns out. Your body makes cholesterol, but we won't go into that right now. At the start of this therapy, what were your goals, your ambitions, your expectations when you started doing the Kachatrian protocol? What did you anticipate would happen?
I think it will be effective in the kind of treatment that I'm doing, because in cleaning the system, because I have been reading some health magazine, and if your system is clean internally and externally, you will improve your health.
How long ago did you start this therapy? How many days ago did you start this? How long have you been on this protocol for?
Several years ago.
No,
Six
the
days.
Kachatrian protocol, the one you're getting now, when
Oh,
did
the-
you start that?
We-
When did you start coming to this clinic?
It's her 6th day.
When did I start?
That is the question.
6 days ago. 6 days ago, you started it.
Oh, when did I start? March 22. I first started coming. March 22, 2008.
Okay. So that would be approximately 6 days ago.
Mhm.
Have you noticed any changes in your health since starting this protocol?
Yeah, I noticed that I have more energy, and then I feel much better, and I think even my hearing is improved.
That's good to hear. Was your hearing a problem beforehand?
Uh, yes, for more than a year now. Sometimes I could hardly hear,
Really?
especially at a distance. If we're talking like now, face to face, I don't have any problem.
Have the doctors told you what they think the problem is with your hearing?
Um, yeah, it says that the brain, they scan it. Oh,
Yes, a brain scan. What did it show?
mhm.
What did the brain scan show? You had a brain scan?
Um, no, it says like a loss. It's not full.
Your brain
Your brain is
I mean,
or your hearing? What are we
my
talking
my
about?
hearing, my brain is okay.
Your brain is okay. It was sounding like you were
a
losing brain.
A doctor,
Yeah.
one time I had a brain scan, and then they said I had a very good brain.
So you want to keep it?
Yes.
It's only sometimes my hearing may be because in the past when I was traveling on the plane and
The background noise makes it hard to hear.
yeah.
Can you hear me normally? Am I not getting through to you? Can you hear my voice okay?
Yeah, only,
Is it hard to understand what I'm saying?
yeah.
It is? A little bit, okay. Has your sleep changed in any way for the better or worse, or is it the same?
I think
The gums.
it's better because sometimes when I get up in the middle of the night, then I sleep again.
So that's better sleep quality.
Yeah, because before when I get up and it takes time before I can sleep again.
Okay. Did you have a problem with your gums or teeth?
Yeah.
What problem did you have?
When I brush my teeth, sometimes they bleeding gum, especially if I brush it real hard. And then when I came here, I was given this solution. The
solution was
the
placed on your
acid
against your
water.
gums.
I put it in my gum, and I noticed there's improvement. And so this morning, when I brush my teeth, it's not bleeding.
That's wonderful. So your gums have improved, your sleep has improved, your energy has improved. Is that correct?
Yeah, my energy has improved because I noticed like this morning we have to go to downtown LA and we don't want to take our car, so we had to take the bus, and we saw the bus is already coming, so we had to run to so we won't miss the bus.
Oh,
And,
wonderful.
yeah,
And you
this
were able,
morning.
you were able to run.
Yeah, we had to run, so otherwise the bus will pass us,
I see.
pass
Well,
by, and
so you have a lot
we
more
will
energy.
miss the bus, and then it will take several minutes before we will be having to ride on the bus. So-
Okay, very good. Thank you very much.
And I'm for my own experience, I'm glad about this treatment, and there's no problem about it. I would even recommend it to anybody.
Thank you very much.
You're welcome.
I'm Dr. Alan Schwartz. We've concluded an interview with Monina Puring. She has been on the Kachatrian protocol for only 5 or 6 days, and she's noticed a dramatic improvement in her general health. The gingivitis that was bothering her has apparently cleared up. Her energy and sleep quality are improved, and she still has another 2.5 weeks to go in this protocol, which is 21 days altogether. We look forward to interviewing her again, perhaps midway or even at the end of the therapy, to see if these improvements continue. We will also be monitoring her blood pressure and her blood sugar at the end of the therapy and during the therapy, and we'll see how those factors are doing as well. Thank you. I'm Dr. Alan Schwartz, and we're continuing our interviews of patients who have started Dr. Kachatrian's protocol. The protocol does not involve using any medications or supplements except for probiotics. Ringer's lactate solution that's activated is the only solution that's used in terms of an intravenous therapy, and orally the participants in this program are getting pH adjusted water essentially to drink. They're also getting it through nebulization. And we're going to interview another patient who has just about completed the protocol, and here she is. She will introduce herself and relate how she felt prior to, during, and then currently at the end of this protocol. Okay. Can you tell us your name?
My name is Monina, and I'm here in Dr. Schwartz's office. And originally, I did not come here for treatment. I just accompanied my sister to
Support.
consult Dr. Schwartz. But when we found out after 3 days about the procedure, what they're doing, so me and my other sister decided to come and also do the treatment. And I'm glad I did, because I found out that I have more energy. I can even run faster than before, and my sleep also is better, because when sometimes I woke up in the middle of the night, it's kind of hard for me to go back to sleep again. But after going to this kind of treatment, I found out that even I woke up 2 times and then I go back to sleep again. So my sleep is better, and also my hearing is improved, and my gums also, they're not bleeding as much as before. After I treated the procedure, the acid and the alkaline, and so I'm glad I really came.
I'm glad that you're having a good experience. Were
Yeah.
there any adverse or bad consequences that you had during this procedure? Any side effects or downside that you can relate?
No side effect at all. In fact, I felt much better,
That's good to hear.
and even with all the procedure that is going on, and no side effect for me, I feel much better.
We would like to have you and the family come back sometime in the future to see how long this better feeling persists. When will you complete your protocol?
After we complete the procedure, and in fact, we were wondering about the maintenance, how we are going to do it, and I don't mind going back for.
We will give you a program that will involve drinking more of the alkaline water after you go home at the end of this program. And Dr. Kachatrian can discuss what else he would like to do in terms of follow-up at the end of this program. When is your last day here?
This Friday, that's our third week, and we were going to ask how we
What to
can
do after that.
the maintenance after this program is over. But I'm really glad I came
I'm glad to hear that.
to undergo this kind of procedure and the program that is being conducted here. And I can recommend it to anybody.
Well, that's good to hear. Dr. Kachatrian has experienced his protocols over the last 30 or 40 years, and he finds that the benefits continue after the initial 3-week period is stopped. But he generally has people continue drinking the alkaline water, and that's something we can discuss on Friday when you come for the last visit. Thank you very much.
Thank you.
Again, I'm Dr. Alan Schwartz. Today is close to the end of the protocol, which is a 21-day protocol that Dr. Kachatrian has designed. And we're getting pretty consistently positive feedback from our clients. The vast majority are noticing improved sleep quality, which gives them more energy during the day. And many of them are noticing other adjunctive benefits. Cancer tumors are shrinking in those patients who have cancer. Blood pressure comes down in those patients that have elevated blood pressure. Weight is an issue that's interesting in that patients who are underweight tend to gain weight, and patients who are overweight tend to lose weight, so they approach their optimal or ideal weights. In addition, other benefits have accrued some patients. As we've just heard, patient Monina had a hearing problem, and she's noticed that she has increased hearing acuity, not normal just yet, but improved. Earlier, she was unable to hear conversations when she was driving in the back of the car, and now she can hear a good deal of the conversation. Although we have not measured this hearing increase objectively, subjectively, she's noticed it, and the people around her have noticed it as well. Dr. Kachatrian's protocol, again, is not designed to heal any particular disease. It's designed to improve wellness in the body, and it does appear to be doing that. At the end of the first 3-week group of patients, we have had consistently good results, and we hope that will continue with the next group of patients that we are starting shortly. Thank you.